So it looks like we have Jason Davis on our call now, representative from Lane County Public Health. So take it away, Jason.
Yeah, I do apologize for being late. We've had quite the day. If you weren't tracking with the county's website or our news, we opened up our pre-registration process today, and it wasn't without glitches. So we had quite a few things to attend to, and I do apologize for those who tried to pre-register but got the fact that we tanked the county's website. About 75,000 people pre-registered today within a matter of about 6 hours. So turns out that that's too much from the Lane County website to handle. So we had to find some workarounds. But I understand that you would like just sort of an overview of the county response, and then specifically around vaccination, and kind of hopefully understanding a few different points about how we got to where we are and where we go from here. So obviously Lane County began its COVID-19 response back in early February of last year. So we've been working on this for a full year. I can't believe it. We've been in emergency response. Typically, I'm the spokesperson for all of Health and Human Services, but we've been focusing in on just COVID-19 now for 12 months. And in that time, we've sure learned a lot. I think it's first and foremost, we have to start off with the fact that I don't think we were ready for something like COVID-19. I think that we had prepared for things like H1N1. We had prepared for outbreaks like meningitis at the University of Oregon, but a global pandemic with a novel respiratory virus that affected everyone at the same time, I don't think we were prepared for. I think, from this point on, the lessons learned have equipped us to be able to respond to similar scenarios going forward. And so that's the silver lining, I guess, in the push and pull that has been the pandemic response. So early on, like I said, we were really focusing on a Lane County response and didn't really look to the state for very much guidance. We took our direction directly from the CDC. Since then, we have gravitated more towards kind of being under the state's umbrella, specifically looking at the vaccination effort. And the reason for that is the state has made their case with local public health departments that it is of benefit for everyone to be rowing in the same direction to have a coordinated response. So in August, we started looking at our vaccine administration planning, and realized obviously it's based on H1N1, and so we dusted that off and started adapting it to COVID. We identified mass vac sites. We went ahead and signed contracts for those 3 sites: Late Event Center, Autzen Stadium, and LCC. And then we looked at how we could do a distribution model. So a lot of our planning, unfortunately, was around sort of the thought that we would have at least anywhere between 150 to 200,000 doses coming into Oregon based on population. Those were our early estimates with the Pfizer reports and with AstraZeneca and some of the early developers. And so that's where our planning went. Unfortunately, as you are well aware, that has not been the case. Oregon's averaged around 30,000 doses per week, sorry. And then Lane County's allocation has ranged anywhere from 0, such as this week, of new doses, except for the eligible populations outside of 1B, to I think our highest week was around 4,600 doses. So just to kind of give you an overview of the way the Oregon Health Authority has decided to administer the vaccine, they assembled a committee of individuals that represented sort of a broad cross sector of industry, professions, both public and private sector, and then also individuals who represent our BIPOC community. So at that state level, that vaccine advisory committee has been giving recommendations to the Oregon Health Authority and working with them in the governor's office to sort of outline who would get the vaccine first. And they came up with this phased approach. Phase 1 was looking primarily at certain pockets of the population and trying to get them vaccinated. And then phase 2 would be the general population. So what we've learned, I think, in Lane County is one, it's very hard to plan when your weekly allocation is unknown. I've told people that it's very similar to saying to your significant other that I want you to make dinner tonight, but I'm not going to tell you how many people are going to come over, what we want to have, or where we're going to have dinner until about 5 minutes until we start. And so that has been the case up until this point, and it's been rough. Phase 1A is predominantly healthcare workers with a few other categories thrown in there as well. So we have, in that group 1, there's 4 groups within 1A. We have hospital workers, our first responders, including EMS, and then just sort of those kind of frontline medical workers. Groups 2 and 3 were individuals who work in behavioral health settings, individuals who work in congregate care settings, and individuals who either have family members with intellectual or developmental disabilities, or work in those intellectual and developmental disability settings, as well as home health care workers. Also, sorry, I forgot, within group 1 is long-term care facilities. And then group 4 is your primary care providers. So, just your general practice doctors and outpatient settings, such as that. So that 1A population in Lane County, there's roughly 40,000 people. And so our average weekly allocation has been about 1,400 doses, if we're lucky, and that's accounting for those high, 4,000 to 5,000 highs, and then down to 0, like we did received this week. They've also, the Oregon Health Authority went ahead and green lighted 1B1, group 1, which is our educators. And that includes early learning, as well as private schools, charter schools, and childcare facilities. That was a direct result of that state level vaccine advisory committee. We get a lot of questions from people saying, why in the world are teachers prioritized over this group? Or why are individuals who work in congregate care settings prioritized over let's say your general practice providers? And honestly, our answer is it's the state's decision on that vaccine advisory committee. I mean, we can find ways to justify the decision, and I certainly think they do have some salient points. However, we look at across the United States, and 45 other states have decided to do it differently than Oregon. We're one of a sort of a cadre of 5 states that has followed this sort of protocol of looking at your healthcare workers, and then your teachers, and then your senior population. And that brings me to who is next on the vaccine eligibility list, and that is our senior population, 65 and older. Again, we're looking to state guidance. They decided to do this in what they call waves. And these waves, there's 4 waves, and they're divided up in 80 plus is one wave, and then you go in 5-year increments. So 85 or 80 plus, and 75 plus, and 70 plus, and then 65 plus. And for every 5-year increment, the eligibility lags about a week. So we will have, beginning this Monday, February 8th, we will have our 80 plus population eligible to start receiving the vaccine. For about a week. They will be the only members of that 65 plus population eligible, and then it will move on to our 75 plus, and so on and so forth. We estimate that by early March, every 65 plus individual in Lane County should be eligible to receive the vaccine, which is great news. However, we still don't have enough doses to vaccinate all those people. And so we are being asked to continue to vaccinate the 1A population while vaccinating the B population, that 1B group 1 educators, and then also beginning to vaccinate our senior population. And I think from a public health perspective, it has been a very haphazard doing this, because when you have these groups that are very hard to sort of suss out and sort out, and that in and of itself adds time to your process of being able to verify these individuals if you're being asked to do so. for a specific strategy to make use of these limited resources. And then to add on to that, to sort of greenlight new groups and roll through it when you haven't even begun to take a bite out of the first group is tough. And again, it's really all about supply. We can move somewhere between 2,000 and 2,500 just public health in a day in terms of vaccines. When we bring in the National Guard, we can double or triple that. Our mass vax clinics are designed to do between 10 and 15,000 individuals in a day if we had vaccine doses. We've also established the a relationship with our local provider community. So there's a number of providers who are enrolled and trained to be able to administer the COVID-19 vaccine in the community right now. We can allocate doses to those clinics if we have them, so that they can begin vaccinating individuals. And obviously for some folks, they would rather not go to a mass vaccination clinic. They would rather go to their provider and receive a dose. And so we enabled that. Our hospital partners are also doing vaccinations. Obviously, they began with themselves, but they are working to help us vaccinate both that group 4 within 1A, again, your general practice doctors, and also your outpatient settings. And then they will also be a key figure in our 80+ vaccination process. So some of you who may have enrolled, who are over 65, within the coming weeks, you may very well receive a call from Peace Health or McKinsey Willamette to come in and receive your vaccine. Or potentially Lane County, we will, depending on doses, obviously. Another function of our vaccine process is what we call our mobile public health units. So we partnered with Eugene Springfield Fire to have mobile public health units with these teams that go out to hard to reach individuals who maybe live in remote areas or don't have transportation, and we're actually able to go and provide vaccines to them, either at a door-to-door or a centralized location. And then we also have our pharmacy partners. As you know, the federal government back in November established a contract with Walgreens and CVS to try to begin vaccinating our long-term care facilities and their workers. That was aside from local public health, and it did circumvent state involvement as well. So that was a contract directly with the federals or the feds. That has been rough as well, because initially they didn't use our data system Alert, where when they actually administer a vaccine and they enter that into Alert, we since solved that problem. So they are entering the data as they vaccinate. But then again, it's been tough to work with all these different moving parts. It's much more efficient if we have one entity sort of coordinating the overall vaccine response and sort of working with those partners as a distribution point. So with this new federal program that you've probably seen in the news, where we have another federal contract, again, directly to Costco, Bimart, Fred Meyer, Albertson, Safeway, a number of different pharmacies. That contract's going to work a little bit different. It's going to, the doses are actually going to go through the state, and then they're going to coordinate with local public health. So we will actually be able to use this new data system that we launched this week. So everyone will be working from the same playbook, so to speak, being able to see who's eligible and being able to set up clinics and give out doses from the same database, which I think will improve the process tremendously. In terms of the education, I'll touch on that really briefly before I take any questions. I want to save the majority of what's left of the time to take questions, but the education doses, to date, we received 1,700 in our first allocation. All of those went to public K-12 schools. And then we received 3,600 doses specifically for that population in our second allocation. And 1,700 of those went towards our early learning and childcare facilities. 300 went to private schools, and the remaining 1,600 went to K-12 local public health. So as of this week, we will be about halfway through that 1B group 1. And I think, obviously there's pros and cons to prioritizing the education sector ahead of some groups. But I guess the good news is, if you're a parent, it does mean that there's a possibility that your school will either be in a hybrid model or back in full class, full in-person sessions sooner rather than later. I think that that is enough of me talking, at least at you. So I'd like to open it up for anybody who has any questions or would like to dig deeper on any subjects.
I have a few questions. When you talk about, you opened this website and you had like 75,000 people already. And I happen to be one of those, but I'm wondering about what kind of sorting is going on with those thousands of entries, and are they going to our doctors and to Peace Health and to our pharmacies, and how are they prioritized within each group, and how assertive do we need to be? Because, do I need to go to my pharmacist and my doctor and be on this list and talk to Peace Health? Are the people who are most actively vocal are the ones that are going to get it, or is it okay to just sit back and wait? I think there's a lot of apprehension about next steps once you're enrolled.
Yes, and rightfully so. I think we've been trying to put out as much information as possible and talk as much as possible. It's hard to do when you don't have a lot of information, obviously, because people kind of catch on that you don't have a lot to say. And so that's been sort of a fine line. My best advice, though, is that the response to that sort of people not knowing what to do and being very anxious about what to do is this centralized database. So by enrolling, you have taken the best, most proactive, most assertive step you can take. That centralized database is going to be used by Peace Health, by University of Oregon, by all of our partners that we have convened under a coordinated response, a coordinated vaccine response. So the one exception to that is before we launched this new centralized database, Peace Health had already reached out to some folks who were patients of theirs through their Peace Health medical group, primary care provider group, and set up appointments for those individuals. And so primarily within that 80 plus age group. And so those individuals should absolutely maintain those appointments and continue to rely on that initial enrollment. For everyone else, if you have not been contacted by Peace Health or vaccine scheduling, enroll in our system and you will be contacted based on the current eligibility. So within the questionnaire that you filled out this morning, if you filled it out really early in the morning, around 6 a.m., there was a version on there that did not have pre-existing conditions because that's not currently part of the state guidance. The Vaccine Advisory Committee announced last week that they were including pre-existing conditions as well as essential workers, but they have not released the guidance on how they want that done or how that prioritization is going to work at all to local public health. So we're waiting on that. But in the meantime, we decided to go ahead and add that in there. So the questionnaire will account for your age, and that's the first prioritization. So if you're 65 plus, you will be part of the group outside of that healthcare and congregate care and behavioral health and intellectual and developmental disability community. You will be, and educators, you'll be the first group to be kind of the ones to be vaccinated by this list. And all of our providers will be operating off of that list based on your age. To our knowledge right now, Oregon Health Authority has not decided to incorporate pre-existing conditions for individuals over 65. Why? I don't know. They're relying completely and solely on the age. So your best bet right now is just to fill out that form based on your age, and that will sort of move you up in line and get you vaccinated sooner than any other qualifier within there. We also are asking what you do for a living, and primarily, do you have contact with the public in your job, and have you had to work throughout the pandemic? And so that would be our essential worker. And rather than trying to parse that out, because honestly, everybody considers themselves an essential worker, we are just going to go by the guidance that if you've had public facing contact, meaning, customer service of any kind, if you're having to do anything where people are coming into a store or you're having to interface with the public at any time, then you'll be considered an essential worker and prioritized that way. And then also your pre-existing conditions. The CDC has made a list of two different categories that we're going to lump together in terms of pre-existing conditions. And I'm sure most people have already learned what those pre-existing conditions are, but we went ahead and asked about those. So you're just going to check a box regarding your pre-existing status. And so really right now, those are the biggest qualifiers that will prioritize folks. And yes, we are looking, we have a team of about 15 people that all they're doing is looking at that data that's coming in that centralized database and categorizing it based on the answers to those questions. We did attempt to have that be automated, but we found that there's going to be way too much room for error in the automation. So we're having to do that by hand and really look at each individual registration and categorize people based on that prioritization. So the good news is the first one with age is the easiest. It's not only the easiest to categorize, it's also the easiest to verify because we all have some form of ID. So unlike a healthcare worker, a home healthcare worker who may or may not be licensed, but says, you know, I take care of 5 people, it's really hard for us to verify that. Well, your age, it's a lot easier. And so that process will hopefully move much, much faster. I would like, just before I stop on that subject, I would like to just really appreciate, though, your question about the assertiveness and what you need to do. So with the caveat that I said, like the best thing you can do is to register. If for some reason another opportunity comes your way, I personally would take it. You know, if you get called for a vaccine appointment, take the first one you can get. The doses are so rare right now that I would jump all over that. I personally have not been vaccinated yet, primarily because I've done most of my work from home. But yeah, the first minute that I am eligible and the first call I get to receive that vaccine, I'm going to do so.
Laura, your hand's up.
Thank you so much for being here tonight. I see you every day on TV, in Zooms. You must be working 24 hours a day.
Pretty close.
Yeah. So, you know, thanks for being with us. So I tried to register. Well, I did. I think I registered on that site today, but I had an interesting experience, which was that there was no way to enter my birth date. I entered it and then it never showed up on my email. So in order to enter my birth date, I literally had to swipe or tap 75 years worth. Is that intentional? I mean, is that somehow going to get us to stop registering? Because it didn't work for me. I went ahead and tapped, and everybody I know is scrolling and tapping and scrolling and tapping. 80 years, 85 years, you know, it's really kind of crazy.
Yep.
So that was odd, and I wondered about that because other people have done it and they didn't have any trouble. So, and then the other thing that I wanted to know about was where will these vaccines be given? Because I hear people going to the hospital and there are 15 desks with people waiting to vaccinate somebody and not a patient in sight. And then there are all these lines. So it's confusing. So if you could enlighten me, I'd appreciate it.
Absolutely. So the first one I'll take is about the form. So we utilize a service called Cognito Forms. At Lane County, we are only allowed to use Internet Explorer. And so when we tested the Cognito Forms on Internet Explorer, everything worked just fine. Turns out when you use different browsers, it doesn't work so well on that specific function with the age. And so we identified that problem, I think around 9:30 a.m. today, and immediately got in touch with the vendor and started talking about possible workarounds. I do anticipate that it will be resolved hopefully by tomorrow. But in the meantime, if you are not sure that you have entered your age correctly and are worried about that, then I would encourage you to email COVID vaccine at lanecountyor.gov. And I can well, let's see, I could probably email whoever set up this meeting. I can email them some notes after the meeting, including that email address. We had a number of people who had contacted us, and a number of people said, I actually entered my age as 1 year old because I just, scrolled and hit it, and then I couldn't figure it out. And so then I just submitted. So we're going to have quite a bit of sorting to do. And currently the vaccine that we are administering through the county is not approved for individuals under 18. So obviously if someone has indicated that they are 1 year old, then we will see that as an error and we will follow up with them to some degree. But I think your best bet in terms of trying to remedy the solution as fast as possible is to email us, and then we can right that wrong for you. And then moving on to your question about where will the vaccines be administered. And so that really depends. If you have a primary care provider who is one of our clinics who has agreed to participate in our vaccine rollout. So right now that is all of Peace Health Medical Group, Mackenzie Willamette, OMG Oregon Medical Group, and then several other smaller providers, and then Nova as well. If you have visited Nova within the last year, then you will probably be contacted by that provider, just because they already have your ELR, your electronic health record. So in terms of people who are not, who don't go to one of those clinics or those providers for their healthcare, we will be doing drive-through clinics for individuals who can attend a drive-through clinic, who have their own transportation, or can have a relative drive them. And if you are not able to, then we will have our mobile public health team to a smaller extent be able to actually physically come out and help people who are not mobile. And then in terms of our pharmacy partners, we have been informed that Fred Meyer, Bimart, Costco, Safeway, and Albertsons can all administer around 100 doses per week, which is a very small drop in the bucket. So we are working to try to figure out why they can only administer 100 doses and whether or not we can loan staff to them to improve that process. So they might contact you as well. I think the underlying sort of base message is that you might be contacted by a number of different entities, but none of those entities are going to ask for your social security number, and none of them are going to ask for any kind of monetary compensation. So if someone calls you to schedule a vaccine appointment, what they should say is, we received your registration through the Lane County centralized database. We'd like to schedule you for a vaccine appointment because you are eligible as part of phase 1B group, wave 2, wave 3, wave 4, whatever it is. What is the best day for you? We currently have clinics on Tuesday, Wednesday, or Thursday. If they mention anything about your social security number, if they mention anything about a credit card number or anything else, hang up. And so that is the way you will be contacted, is primarily via phone. There will be some people who have indicated that they prefer email communication. They will receive an email. And so that's the way that folks will be vaccinated. I think the vast majority of the folks who don't get a call from a direct provider will be asked if they could participate in the drive-through clinic. And I don't know if you've seen any footage of the drive-through clinics. We've been doing them at several different locations. The main location right now is Lane Event Center. You drive in sort of off 13th there, and we have cones. You drive through, you're handed clipboards. You take about 2 or 3 minutes to fill out a few basic, have you ever had an allergic reaction, anaphylaxis to a vaccine, et cetera. Some different paperwork. And then you move on to the next stall where you actually get the vaccine in your arm through your car window. And then you pull into a parking spot where we monitor you for 15 minutes after the vaccine administration. And so it's not like the big long lines that you've seen in other states with people waiting outside for hours on end. It's I've been told that it's around a 30-minute process from when you enter to when you leave. And that's when we're doing roughly 2,000 people a day.
Excuse me, I'd like to reference to the problem with getting your date in your form, your birth date.
Yes.
I had that problem. I was only like 4 months old. And then my husband pointed out that in what I thought was simply the title bar where it showed the year,
Mhm.
If you click on that, you can scroll through all the dates. But it
Right.
looks like it doesn't look like it's something you would normally click
Yeah, we
on.
filled this out. We
So,
filled this out yesterday.
yeah, we did this yesterday.
Yeah.
Is that going to count?
So.
Yes, absolutely. Your
Okay.
registration does not go away. Even if even if you entered your age wrong, your registration is secure. And I
Well,
think it's worth,
because you put the new registration out today, and I just,
it's the same database though. They're feeding into the same database. The new registration was actually launched yesterday. We didn't launch it. We just put it up on the website because we wanted to try to have a small population of people that we were on our 1A wait list use it so that we could identify any kind of bugs. But then Tracy Berry from KKNU saw it and started broadcasting it, and then it got shared. And I think we were averaging around 3,000 people an hour after that point. So, and then today, obviously, it blew up. But yes, your registration absolutely, even if you did it yesterday or if you did it today, it absolutely is secure. But your age will be an issue if we don't correct it. So again, that's going to be important for me to give you that email address. I'll probably be talking about this in the news tomorrow too, because it's going to be important enough that we need to make sure that anybody that needs to correct that does.
Jason, if
But
if you say the email
Sure.
address again, I'll type it in the chat right now.
yeah, absolutely. So it's COVID vaccine at lanecountyor.gov. And what you need to do on that is in the subject bar, if you can, just say registration question, and then in your body of your email, go ahead and let us know your name and what your date of birth is. And then also we will have your email address. If you entered a different email address than you're using to email us, please indicate which email address you used in the form. Because between those three things, we would be able to identify you. Just understanding that there's probably going to be more than one Bill Smith in Lane County.
Michael Neiman, you're next.
Got it. First of all, I just wanted to thank you for all your work. It's very impressive what you described, and it's really very much appreciated. I've only lived in Oregon for about 6 months, and I've called Lane County Public Health 3 or 4 times, and I've been very impressed with the fact that I've always gotten a hold of someone, and they've always answered my questions. So, but I had a question. I registered this morning, and I was just looking at my response from the county, and it listed all my questions and my answers, and I didn't see any question about anything pertaining to pre-existing conditions.
So you did you register before 9:30 a.m.?
Yes,
Okay. And are you over 65 years of age?
yes, sadly.
Okay. No, that's great. So
The first time it's been great.
yeah, I am looking forward to being over 65 years of age because 40 right now just seems unbearable. But so what I will tell you is that your pre-existing conditions, if you have any, will not count towards your eligibility because your age will actually supersede those pre-existing conditions.
I see.
And yeah, and so we will have some individuals who will have to go back and add the pre-existing conditions for those individuals who registered before 9:30, because that's when we added that question in there.
But I don't need to
No.
do that. Okay.
No,
I had
your
one other-
age, yeah.
I had one other question. You mentioned about the uncertainty about doses, and I just wanted to know if that's improving. My impression from following the news is that it is or should be based on what I'm seeing. And I also wondered if you could give a prediction or a guess as to when the 65 plus population vaccination will be completed, like if you had to guess, or if you have absolutely no idea, that's fine too. But that'll give me kind of some idea, since I'm probably near the end of that. I'm 65, so I'm near the back of that line.
So I'll take the first part of your question. They're both great questions. The vaccine allocation process should improve from the feds and or manufacturer to the feds to Oregon. It should. It's improving dramatically on a global scale, and it's improving dramatically at the national scale. But what we've seen is Oregon's been deprioritized, partly because we've done comparatively good job of keeping our cases low. Also, we have one of we have our population density is not nearly what some places like California and New York are. And that factors into the allocation numbers that they distribute nationally. So what I've heard the last sort of go around was with the Johnson & Johnson approval, and then additional doses being added, Oregon could potentially see a 5% increase. And that will be passed down to Lane County. But like I said, we've had weeks where we've received 0 doses, and it's going on a weekly basis. So anything's an improvement from 0. And just, if you were trading stocks, this would be very volatile. This would be a volatile investment, where one week we're up in the 4,000, 5,000, the next week we're down to nothing. And so I would hesitate before making any kind of predictions because of that volatility. However,
Fair enough.
I think that at the worst case scenario, we should be able to move through our senior population in 2 months. And the reason that I say that, and so that's looking at the remainder of February and March. The reason I say that is because we've been pushing back very hard in the state when they start to greenlight these other groups while we're still vaccinating. It really confuses things. It makes the process very, very untenable. And quite frankly, our 65 plus population are the individuals who are most at risk. We need to protect them. And so we're going to be pushing hard to prioritize making sure, or at least making sure that we don't start vaccinating other populations in the process. Now, having said that, we just heard the judge's ruling, indicating that inmates need to be vaccinated, which, there's a rationale for that. However, that slows the overall vaccination process down because that's 10 to 12,000 doses pulled out of the overall allocation. So every time something like that happens, we see our doses go down. But that would be my best guess is 2 months to vaccinate the 65 plus.
Fair enough. Thank you very much.
Of course.
I have a question, Jason, or Ed had his hand up. So go ahead, Ed.
Well, Mary, if the queue is Mary, Laura, Ed, Tim.
Yeah, I don't have a question. I just have a comment. My husband got vaccinated at Lane County Fairgrounds about a week and a half ago. And I just want to tell you, I was amazed by how well it went. It was a logistical nightmare to pull that off. And you guys pulled it off in the rain. Everybody was great. It went really fast. And I can't tell you how impressed I was. As someone who used to coordinate volunteers, seeing what you guys put together, I thought it was just great. So I wish you would tell everyone you work with how impressed I was and what a great job you're doing. I know you probably got a lot of help because you're not doing everything, but that went so smoothly that you really know what you're doing, and I was really impressed.
Well, thank you. And I certainly will pass that on. Sometimes I'm embarrassed because I'm not a healthcare provider. I represent them. They're the heroes. They're the people that are doing the amazing work. My hat's off to them as well, because they are very dedicated to this. And most of those folks, I'm sad to say, we really don't pay all that well. And they're licensed nurses and doctors and folks, and they could be working anywhere, but they have a commitment to our community, and that's very admirable. And so I appreciate your feedback, and I will absolutely pass that on. I'm so glad that worked out and it went as smoothly as it did.
Laura, Ed Singer.
Now it says mute. Okay, I guess I'm on now.
We can hear
Okay,
you.
how are you going to validate age? And there was no questionnaire that said there was no question that asked if I was a member of OMG or Peace Health or whatever. So how are you going to find those answers out?
So I'll do your age question first. Your age will just be a form of identification when you come to get your vaccine.
Okay.
Yeah. So we'll just take a look at that, much like buying alcohol or anything else. And so long as you're in that age group, then we're going to get you vaccinated. And in terms of which provider reaches out to you, so the way it's working is all that information is flowing into a centralized database that all those different providers have access to. What I was mentioning earlier about our participating partners and my comments about that was the fact that they have a list of all their patients. And before all the waves, and the eligibility waves that came out from Oregon Health Authority, most of those clinics that we've been working with started taking a census of their patient population and getting the individuals who are over 65 in their own database. And so what they can do is they can look at and compare the two databases and see who registered with our system and who's in their system. If they have a patient that's in our system, they take that patient. But they will also be vaccinating people who are not their patients. And then Lane County will also be doing the drive-through clinic for people who are not part of one of those clinics. But it makes sense for a lot of folks who don't want to go to a drive-through clinic or don't want to do a mass vaccination clinic, or are part of a medical transport service that goes to a certain provider, when they have an appointment, to utilize that service. They have a trusted relationship with that provider and it's more comfortable for them. So we decided to go ahead and utilize those, but that will honestly be a minority of our overall vaccination population, simply by virtue of the fact that we only have a handful of those providers, albeit large providers that account for quite a few folks. But within that 80 plus, or within that 65 plus population, we have roughly 55,000 individuals in Lane County. And then when you start parsing that out based on provider, each individual provider only has a small fraction.
Thank you.
Of course.
Tim Felker and then Laura Shang is the queue.
I
Laura.
I just wanted to let you know, you mentioned Oregon Medical Group and that they would be the ones to contact. Well, I went to see them yesterday. And when I asked about the vaccine, they said they didn't know anything about vaccines. They didn't have any vaccines, and that I should go to Lane County .gov and get on the website and so on and so forth. So at least the Northside Clinic over in our Santa Clara area doesn't seem to have a clue about what they're supposed to be doing with vaccines. So I'm just sharing that, so maybe they could be enlightened or something.
Yeah. So two things. One is a lot of this came together really quickly. So the centralized database, I was one of a group of a small number of people who really pushed for this. A lot of people didn't want to. They didn't want to have people be able to sign up. They said, let's just sign up each individual group that's eligible. And I said, no, we got to give people the option to register right now. So we pushed really hard for that. And part of the problem with doing that is that you don't bring absolutely everybody on. So the leaders of OMG, like Stacy Chance, their medical director, chief medical officer, and some of those folks are in the know. I don't think that they have really made that known, throughout all the clinics and all the people. So it will take some time. I apologize for that. That's probably a little bit disconcerting. I know Oregon, I'm a patient of Oregon Medical Group as well. They do terrific at a lot of things, but maybe they haven't done the communication piece yet.
Okay, thank you.
Of course.
Okay, anything else for Jason? Thank you so much for taking the time and helping us wend our way through a really complicated time in history.
Absolutely, and I do apologize for being late again. I believe it's Catherine who had sent me the invite. Is that you? Okay, great.
That's me.
Catherine, I'm going to send you sort of a list of talking points tomorrow that you can share with the group. Hopefully that will provide a few of those answers I gave tonight in writing, as well as maybe some that you didn't ask that people might be wondering about. Just have them as a resource. And then I'd also encourage folks that when our website does get back up and running, to go to the COVID page and sign up for our weekly newsletter, vaccine newsletter, because in addition to registering to receive the vaccine, we also have this newsletter where we just give you everything we know about the vaccine on a weekly basis, help you keep track of things, and we just try to lay it all out there for you. So thank you for letting me speak with you. And if you have any questions, please do let me know. I'm happy to answer them.
Michael, did you have one last question? You had your hand up? Sounds like he's done. I
Okay,
can't,
very good.
you're mute, Michael.
He's muted.
I just would like to say thank you, Jason, so much for being here. This has been extremely helpful, and it will be helpful to spread the word to others as well. So thank you again.
Thank you.
I thought that was applause symbol, so.
Okay.
I have a question. I have a quick question.
Sure.
Jason, when I filled out the form, I think I put down email as my preference. I didn't think that was a preference over phones. So can I use this line you talked about to change that?
If you would rather be contacted via phone,
Yeah.
please do email us and indicate so. Do include the email address that you use to sign up so that we can reference you.
Okay, thank you.
Yes. And there's another gentleman I saw right before.
Yeah, I just wanted to say thank you from our house. We've been watching you, I guess, for about a year now, and you've had a lot of really great, consistent, and matter-of-fact messages, and we appreciate it.
Of course.
Hey.
All righty.
Go
Thank you
forth and
all.
do good.
Good night.